So good morning. My name is Bleddyn Rees. I'm the Deputy Chair of the ECH Alliance and the Chair of the Digital Health Society. So I'm going to MC very quickly the digital and data theme, one of the three themes that Brian discussed. And just to try and join up the dots around the digital and data theme, there's four things I want to stress. We're going to be looking at data through the eyes to inform and develop public health, to drive screening programs, and to move from disease to prevention and well-being. And then finally, looking at evidence to transform services and outcomes. So you're going to see through the next 3 or 4 speakers, those 4 topics covered. So I'm going to introduce, first of all, Tobias Silverman, who is a partner in McKinsey's Berlin office, and a member of their health practice and their innovation practice. His work is mostly around digital health scale-ups, established healthcare companies and ministries of health. He'll tell you a little bit, I'm sure, about the health tech network, so I won't steal his thunder. His focus is on health innovation and health tech business building, where he supports clients on R&D, commercialization, and scaling questions. So without further ado, I'll hand over to Tobias. Thank you.
Good morning, everyone, and good afternoon, evening online. Such a pleasure being here with you, and thank you, Brian, Bleddyn, Andy, John, Declan, for your important work. You mentioned a few of the foundational principles already, right? But what I really love and why I'm very grateful to be a partner of the Alliance is that there is lots of people that actually come and show up with positive intent, right, to actually make something positive and beneficial happen. Brian and Bleddyn asked me to do a fast and furious run through the benefit of digital health, digitally enabled care journeys, and financing mechanisms, and all that within 15 minutes. So I probably should get going now. And very happy to continue afterwards the discussion. My perspectives are sort of threefold. On the one hand, the health tech network that Bleddyn just mentioned, it's you can think of it as an informal, friendly community of 1,800 health tech CEOs and founders, 300 investors and 400 public sector, social sector and private sector organization, where a lot of innovation and a lot of impact is being created. For Germany, we publish a book that measures the digital transformation of the German health system. So one of my particular interests is how can countries get benefit from digital health and how can they actually create benefit for citizens? And then the final bit is I'm also involved in a health and well-being program for employees. So my role there is being the primary guinea pig. So they try out everything on me, and if I survive it, then we roll it out to more people. So it's also very, very practical. I'll just quickly start with the benefit of digital health and digital health value pools, right? And I think at a meeting like this, where Bleddyn, you mentioned it, we'll be talking about health data screening, digitally enabled care journeys, and all sorts of solutions, right? I'll just start with a quick outline. Here's a framework that I've found useful in the past, about 25 digital health categories, of which the upper 10 are patient-facing things, right, ranging from triage to patient remote monitoring. The middle 10 are roughly physician and nurse-facing, like digital workflows, clinical decision support tools. And then there are really these 2 important underlying foundational enablers, be it electronic patient records and e-prescription infrastructure, which are often public sector hosted or heavily public sector regulated. And those 25 things, right, can then have a lot of positive benefit. And I'm very hopeful there that we can also capture a lot of those benefits for our societies and health systems. So if we start with the benefit of digital health from a patient perspective, looking at the publications out there, right, about 80% of publications show benefit of the digital health that is being assessed. Out of the remaining 20%, there is also a lot of non-inferiority studies, right, where then a digital health solution is shown to be similar efficacy to an in-person intervention. But if we double click into those 80% of publications that show positive benefit, 3/4 of them show patient benefits usually, right? Lower depression scores, lower weight, better diabetes management, etc. About 20% of the population show time savings for healthcare professional, about 3 to 5%, depending on which year we look at, usually show cost savings that could be avoided, hospitalizations and topics like that. If we now sort of switch gears a little bit and say, okay, well, that's great because that's sort of a very personal kind of stuff. What does that mean and how can we actually get benefit from digital health for our health systems and country level, right? Then there an analysis that I find interesting is to look at then all of those papers and map them to digital health categories and cost categories of a health system, and then ask the two questions. What if all of those categories were fully implemented in a country? And what if the country would get the benefit that is published? And if we do that thought experiment, my home country of Germany would get a value of 42 billion every year, right? That's roughly 12% of the total health care spending that we have as a country, right? And the value can be different, right? It can be time saving for nurses, it can be time saving for doctors, it can be avoided hospitalization, right? So it's not like 42 billion that you take out of the system and spend elsewhere, right? It's 42 billion in value that can happen within the system. Then, of course, the question comes, what are now those 25, out of those 25 digital health categories, what are the categories that actually drive more value versus less value, right? I'll not go into I can share that also later afterwards. The one category that I just want to highlight here, of course, is the unifying electronic health record at the bottom, which drives the highest value overall, as it's the sort of foundation of the house, pretty much. But another one that I'd like to highlight here is remote patient monitoring. And this would drive 4 billion in value for a country like Germany, yet we only have one reimbursement code for heart failure, and it's being done at a very low level right now. Right? So there is then also a lot of divergence sometimes between potential value and actual value captured today. Now, some of you might probably say, okay, that's all nice that the German guy talked about the value in Germany, right? But can digital health also provide value in Africa, in Asia, in other countries, right? So this is just the same analysis being done for African countries. And depending on how conservative or optimistic you are, you actually get to similar impact numbers, or let's say value potential numbers. Bledin already mentioned that we will be thinking or probably thinking a lot about digitally enabled care journeys in the future, because it's usually not just one tool or one solution that then magically solves everything. Right? We see that in Germany also with our digital therapeutics DiGA category, right? It's one category, but there is more to chronic disease management than a digital therapeutic, right? So I would like to encourage us for the debate today and tomorrow to maybe think a bit how some of those digital health solutions, right? And I on this slide, I rearranged some of the categories from the previous slides into what that actually would mean from a digital care journey, right? Where then some of those solutions can be stitched together, right? To then actually do digitally enabled chronic disease management or digitally enabled prevention, screening, or other things. This is sort of what it looks like. This is, again, a European example in the obesity space, right, where then different things starting at web journeys then linked together into chronic disease management, be it on then a depression pathway or also a weight loss pathway, and different solutions being stitched together. What I just want to say, one of my favorite examples is a digitally enabled care journey that pretty much no one knows about. This is something that University Hospital Heidelberg did during COVID in Germany, and they did a sort of digitally enabled care journey with patient remote monitoring for COVID patients. And the thesis was, can we actually spot complications arising super early when oxygen saturation goes down, right? And oxygen saturation might go down on day 6 or day 7 or day 8 or day 9 or day 10 or day 11 or 12, right? And people are at home, right? So there were people asked whether they would like to have the university hospital watch over them with patient remote monitoring. It's super simple, right? It's just a class 1 medical device that allows the transfer of data. But to this day, and I would love to see if anyone has any better impact example, to this day, this is the highest impact example that I'm aware of personally in digital health. The mortality of that cohort that was monitored, where complications were spotted early and then intervened early, was 3 to 4-fold lower compared with the mortality of the neighboring municipalities that didn't have that solution. So I think there is a lot of hope and there is a lot of potential, right? The question is, how do we create digitally enabled care journeys and pathway to actually reap that benefit and create benefit for patients, citizens, doctors and nurses. And with that, I'll close. I think one thing that is then probably also important to discuss later, and I, in the interest of time, didn't go too deep into, is how do we also set up financing mechanisms to actually enable that, right? Working on tuberculosis in Africa and Asia, right? Yes, we can do a 2-year grant project, a 3-year grant project, and we are doing that with the Stop TB partnership and do people-centered design on the ground, right? But we really need to be thinking about how do we enable 5 years, 10 years, 15 years of care delivery, right? And what are financing mechanisms that we set up to enable that, right? To go beyond the much needed and much important grants and projects, right? But to then take it one step further. So thank you for the attention and looking forward to those 2 days.